Welcome to Careers in Discovery, your window into the world of biotech leaders. On each episode, we interview the industry's leading executives to understand how they built their careers, what they've learned along the way, and the advice they'd give to their younger selves. I'm back on Careers in Discovery with Søren Melsing, the CEO of EXOCURE, a company harnessing the therapeutic and delivery potential of exosomes across a wide range of conditions. Søren's had a really varied career and has spent time in leadership roles in R&D, commercial strategy, and building different types of organizations. We talked about learning by doing, transitioning from large pharma to startups, and what it really takes to turn a scientific platform into a viable business. So I am back this week on Careers in Discovery with Søren Melsing of EXOCURE. Søren, welcome to the show.
Thank you, Tom. Happy to be here.
Great to see you. I'm really interested in the work you're doing at EXOCURE. I think the whole exosome field is something that we've done a little bit of work around, and we've had people on the podcast who've been in different exosome-focused companies. I think it's fascinating. Tell us a bit about your approach. Tell us a bit about the work you guys are doing at EXOCURE and what you're working on.
Yeah. So our founder, Jan Løtvald, who's a professor at the Gothenburg University Hospital, he started this work 15, 20 years ago. Mm-hmm. Small discovery. Small in the sense that compared to what they know now, it was small, but at the time it was a big deal.
Yes.
Discovered that exosomes, they transport molecules such as DNA fragments between cells. And that has evolved both in terms of a methodology and working with exosomes, and then subsequently sort of applying all that knowledge into, so what can we do with this? Mm-hmm. And that has led on to therapeutics. So today we have three platforms based on exosomes, one in oncology, one in anti-inflammation, and then something that's a little different, which is drug delivery with non-active exosomes. So a great example, it takes time, but applying knowledge, building on it, and following the data is something Jan usually says. Okay. And that he has done, and that has led him to a fantastic place.
Yes, fascinating. And what's the... So exosomes, totally understand this delivery mechanism. I think it makes complete sense. As a therapeutic, can you tell me a bit about sort of how that works and why that has a good therapeutic potential?
Yeah. So exosomes are sort of little capsules of cell membrane. Mm-hmm. And they are immunologically active. So they can suppress the immune system in certain conditions, or if they're taken from bacteria instead of human cells, they can activate the immune system. Now, you don't want an activation like an infection, but what we have are sort of engineered bacterial exosomes that activate the immune system. That's relevant in oncology because you want to get the immune system to attack the cancer.
Yes.
So the therapeutic there is the exosome itself activates the immune system. We load it with another activator, so it's dual activation. There's synergy between those two components, so you get a great activation and a good activity in a cancer model.
Yes.
Stem cells is something we often hear about, but stem cells, they also sort of secrete exosomes, and they're used as an anti-inflammatory in some instances. And again, EXOCURE has sort of engineered those cells into being able to carry more of a payload and being able to target specific tissue and that sort of thing.
Yes.
So that's how the therapeutic principle works.
Yeah, I see. Very interesting. And so you got involved in the company as CEO, I guess about a year ago, coming up to now.
Yeah.
And tell us a bit about where the business is today. So you have a portfolio you're developing, clearly.
The Well, the business is, as many of our colleagues in biotech these days, we're looking for additional funding
Of
because
course.
we have 3 preclinical platforms that are super exciting, interesting, contain both some very interesting novelty and some drug repurposing, where you sort of take what you know and make it better. And why do I emphasize that? I do it because it has a different risk profile. Mm-hmm. And so it's not sort of a one-stop shop. We have different assets. And this is a platform. So this is the exosome field can emerge, and we expect that it can emerge into a new platform where you can develop all sorts of different treatments. So we see a potential, but my task is then to convey that potential to investors and get somebody in to help us move from preclinical towards testing this in humans, because that is the concept that's necessary. So that's where essentially the business is. I wouldn't say we've exhausted what we can do pre-clinical. There is still work to be done, but it needs to be accelerated. It needs to happen. Yeah. So that's really what we're trying to do.
No, that makes sense. And of course, as we record this, we're at the beginning of May in 2025, and it's a challenging fundraising environment for everybody in biotech. And I suppose, I would imagine a lot of investors less familiar with the exosome concept, although there have been some successes in some companies, so there's perhaps a bit more understanding of it there. I guess with a new type of platform, there's different ways you have to think about positioning a fundraise, and particularly in a relatively cautious economic environment.
Yeah, true. And we speak to many different investors. So venture capital, right? They're super competent in everything science and everything biotech and that sort of thing. So they have their set of questions, their set of sort of finding the right box for something like us.
Yes.
And that might not be all 3 platforms. One of them might not fit, and then we need to focus on the others. Whereas if we meet family offices, then they're more, they recognize the benefits of having different platforms, different timings, different risk profiles, and they can sort of manage that within their and then there are the pharma companies who then have a slightly different approach. So depending on what investor you're speaking with, essentially what you want to be able to do is target your messaging to just that audience. And that sounds simple, but it's quite a lot of work.
Yes.
When having to make sort of a bespoke messaging each time you meet a new investor.
Yeah.
So really it's about understanding what you have, the data and all the estimates and the financial bits and pieces, and having a flexible setup where you can make the match depending on who you're speaking with.
Yeah, absolutely. And I suppose, there's an interesting exercise in this, in that anytime you go and get outside feedback on your company, you get a different lens on what you're doing, and that can sometimes be productive and sometimes not, but it's always interesting.
It is. And I say most people are really good at giving some constructive feedback.
Yeah.
And some will just say, you know what, not for us. And that's fine as well. We've come a long way in listening to the feedback and understanding we need to improve and figuring out how can we, we can't make up data, but we can optimize the way we display data, and we can make some estimates and that sort of thing, and sort of make the most of what we have. And that's just the reality.
Yeah.
I think it was with this type of situation and many others in my experience.
That's true. So Søren, I'm really interested to get into kind of the story of your career, because you've done lots of things in your career, from R&D and project management to more commercial positions, and been on several boards of some quite varied companies as well. So really interested to sort of explore the path you've taken.
Right.
I always like to start with why this area for you? Like, why drug development? Why this kind of focus for your career to start with?
Well, if we go all the way back to school, there was always an interest in mixing science with business.
Right.
So I had that dual interest from ever since I can remember. So the question was, how do you address that? And I did it by training as a chemical engineer. And fate would have it that I got employed quickly working with radioisotope labeling. And that's one publication I have is on labeling a penicillin molecule. And I from that experience, that was 4 years in a medicinal chemistry department. I liked it, but it was fairly quickly very obvious that this is not for me for the rest of my life. It's nice people, but something needs to happen.
Yes.
And I think that was an example of a point in time where I said, I'm so sure that something else needs to happen, so I need to find a way.
Yes.
And that took a bit of effort, and ultimately I found people that supported that in the company, and that gave me a way to move from where I was into actually an executive management assistant position, where I learned a lot about the administrative side on running a development organization in pharma. And then I started a master's degree in drug development.
Yes.
So the formal side and the practical learning went hand in hand, and I quickly moved on to a project management position where I really got to sit with all these tools and work with them and work with the colleagues and make it all happen.
Yes.
And the point there is that for me, what's important in jobs is that I learn and I develop. So whenever I've come to a point where that stops, then there's a bell that rings, and then I need to do something else. So that might explain some of the odd changes I've done over time.
Yeah.
But if you sort of look at it that way, then you would have said, okay, Søren, your career path is set. You're in R&D, and you'll move yourself up through that organization. But then took a shift, went to the UK, lived and worked there in the head of the company, doing some finance type work, business support, divestment support, strategy, that sort of thing, and basically learned how a pharmaceutical affiliate, sales marketing affiliate runs.
Yes.
Far from the labs, I would say.
Right.
Pretty far from the labs.
Yes.
And learning by doing. So there's no business degree here. It's get your hands in there and do the best you can, and common sense prevails usually.
Yes.
So I did that for a bit more than 3 years, learned a lot, and then moved back to Copenhagen, but started working in Sweden. And actually a Nordic responsibility for a sales and marketing team where we launched new products towards physicians, both new molecules and line extensions, that sort of thing.
Yes.
So in sort of the span of, say, 5 years, I had moved from an R&D path that looked relatively sort of comfortable, and this is the way to go, into managing salespeople and marketing and launching products and meeting physicians and that sort of thing. And it seemed like a sort of a more or less natural evolution that the opportunity came up. There was some trust. There was me being interested and willing to learn enough to succeed, and then it happened.
Yeah.
The common denominator is that company and the fact that it was originator pharma. So own products that had worked their way up through R&D.
Yeah.
And that brings me to my next point, which is when I then changed into a generic company. And I was employee number 2, setting up the Nordic organization in Aspen Pharma, which is a South African company.
Yes.
We sat there in an office looking at each other. It was a finance colleague from old times and I, and we're sort of thinking, what do we do here? Because we had supply issues and didn't really know whom to contact and what to do. And we had people calling, they were discontent with their suppliers. So super steep learning curve again. And frustrations and difficulties. It's not like a proper startup because we had product and we had an organization behind us. We just couldn't find it in a way. But still that the sense of excitement and frustration that goes hand in hand when building something.
Yes.
And that is just a fantastic learning opportunity.
Of course, yeah.
So I did my best to embrace that. And then after a year and a half, 2 years, it was clear to me that we need somebody else here.
Right.
To take over. Because I've done not all I could, but it was sort of, I need somebody else to have a look at it and take it to the next level, so to speak. And there was full understanding of that. So I left and went to a small organization again in Sweden that is part contract developer.
Right.
So develops drugs on behalf of others and then have their own portfolio. And I was employed to build a strategy for their own products, for in-licensing, for out-licensing to other companies, and for essentially setting a pipeline for internal product development.
Yes, I see.
And that's the first time where I've combined my R&D background with my commercial background to that extent. And that was great. And then came our good old challenger, which is funding, came along. And it turned out that the strategy looked nice and it was all laid out on paper, but what was missing was a number of million euros to put it in motion.
Yes.
And I think that's fair. When done in a company that isn't looking to get listed or whatever to bring in that kind of money, it'll just happen very slowly. Because funded via the normal operations, and that didn't fit with sort of the mindset I had at the. So I was given a new opportunity, and again, a combination of product development and commercialization of prescription pharmaceuticals in a Danish company called Orifarm, which is a very big player in the parallel trade field.
Okay,
which is although it deals with pharmaceuticals, it's pretty much a trade business. So it might as well be Christmas trees, as one colleague said. But my part in it was that there was an ambition to grow the prescription pharma area in the company. Yes. So both grow it in terms of commercial acumen within those products, the prescription products, and then aligning the business development to find new products and bring them in and grow via that. And again, a fantastic learning experience. Because that was an organization that wasn't sort of really truly pharma all the way through. It was pharma, but then it had that trade element with which very different metrics to it, very different expectations, much more sort of a finance mindset than the science-based commercial mindset that we're used to in pharma.
Yeah.
And then came a restructuring and a change in strategy, and that meant the end of me, and that was very fair. So then I had the opportunity to sort of think, what now? And that's the opportunity came along for EXOCURE.
That makes sense.
And that was from much more finance, much less science to loads of science. and having to understand the science well enough to communicate it in a way where it's balanced and being part of a very big team, leadership responsibilities, organizational politics, all of what you would expect in a large organization to being in a super small organization.
Right.
with founder and a board and investors, direct contact. If something happens, it needs to be you that do it and sort of puts it in motion.
Yes.
So massive change, but for the better in my perspective.
No, absolutely.
Over the years, I've had some board roles as well.
Mm-hmm.
And I suppose that was probably the best learning I had to sort of set some level of expectations.
Yes.
What is a job like that? What type of organization? How does it work with a small organization, raising capital continuously as you do, and you work for? And let me just say that there is a difference between being on a board and then being fully operationally involved in driving something like that. Of course. But man, is it healthy? It's healthy to try. When in the bigger companies we're asked to cut our budgets by 10%, we scream and we cry and we argue for why that will be the end of the world. But if you flip that to, hey, you might get 20% of what you're asking, you'll really be happy and grateful. Those 20%, because it means that you can actually move your things forward. Different perspective.
Yes.
On something that might be more or less the same amount.
Yeah, absolutely.
So I think from sort of my own evolution and ability to see things from different perspectives, that's something I've taken with me.
No, it makes sense. I often think there's nothing like running a small business to make you really appreciate the value of every euro, every kroner, every dollar.
Yeah, exactly. So that's sort of been my path.
Yeah.
And not one you could have designed.
No.
Not one you could have predicted. And is that good or is it bad? And that's something I've reflected on quite a lot. What would I have done differently?
Yes.
And maybe from an educational perspective, there are things I would have done differently. Different timing and different focus. But I think there is also an element here of how much can you actually predict.
Yes.
And how much can you sort of target your way through life? Now, I think in some instances you can. If you really want to go in with everything you've got and you know exactly how to do it, where to go, and if you're a management consultant or if you're in a big organization and you sort of follow all the steps, the path gets pretty much laid out for you.
Yeah.
But eventually some go all the way, but of course there are fewer and fewer that can go all the way because there's not that many roles as you move up in the system. So the question is, at what point do you start to sort of move your perspective to somewhere else? And can you manage that change in environment? All of a sudden you don't have 10 colleagues, each of whom is an expert in that area. You need to sort of balance it all yourself. And is that stimulating that you can apply what you've learned over 10 years in a big company? Or is it something that scares you because you won't have the backing that you're used to?
Ideally, a little bit of both, right?
Yeah, but I would certainly argue don't fear it, because again, common sense prevails, and what you learn over the years is there's an area of expertise, but of course, as you interact with colleagues, you get that sense of the broader picture. And you'll never be an expert in a completely different field. So you'll probably need to find somebody to help you if you really need to go into an expert field. And then we'll see what AI does, for example, because there you sort of get access to something that we haven't really had before, that quick, pretty good idea of how does it actually work. And that can get you on to the next step without having to sit and wait and call somebody and wait for them to answer and that sort of thing.
Yes.
So there I actually think that technology will help us stand a bit more on our own feet and not depend so strongly on expertise, unless it's something that really requires deep expertise that we cannot do without.
And I think as well, this won't apply for most things, but there are certain things where there's knowledge and then there's understanding, right? And especially when you're doing something new, that sort of core in-depth understanding of the principles that have gone before allow you to then apply those in an abstracted way to something new. Having the knowledge wouldn't help you with that because you don't really understand the structure of that. But I think for sure, there's a lot of things that you just need the information, right? You need to know how to do the thing and what the process is and all that. And I think for those sorts of things, AI will be, and already is, transformational. And one of the conversations I have with our clients all the time at the moment is it's incredibly hard to predict how many people you're going to need in a business in 2 years' time, because who knows? But yeah, I agree. I think it will lighten the load of deep subject matter expertise, except in the areas where it's really core to what you're doing, which will be fascinating to see what it makes people capable of.
Yeah, it will. And hopefully it'll help with transparency as well. You tend to get the same answers. You have this access to information, and pretty much all will have access to more or less the same information, and it's distilled in more or less the same way.
Yes.
And that helps with transparency. You don't have that one person who has the access that sits there with all the cards. And that makes for a more even playing field.
Mm-hmm. Yeah, absolutely. So there's several elements of your journey that I'd like to dig into. There's several interesting things that you've said there, Søren. I suppose the first is you've had this breadth of experience across different stages of drug development, different areas of the pharmaceutical industry as well, in terms of generics and various different aspects. And you've brought that back to a very research-driven organization now. Mm-hmm. A lot of our audience is very scientific, very technical in their knowledge, expertise, outlook, and they have different varying levels of experience. Because you've focused a lot on the commercial elements and the business elements of the industry, mm-hmm. What are some things, do you think, that perhaps more technical people don't realize about drug development that would be helpful for them? Like, what are some of your observations around that?
I think that particularly in discovery, we would tend, and I say we because I am now a part of that, and I've been part of that before. We tend to aim for the stars, right? We want a new chemical entity or a new, biological entity. We want something that's transformational. Mm-hmm. But the closer you get to clinical practice, actually, sometimes the smaller increments might not be as useful, but they are useful. They're appreciated. They add value.
Yes.
And as does generics, because generics pave the way for the new treatments coming in a way whereby you can actually pay for those new treatments.
Yes.
And pay for the R&D. So there's an ecosystem understanding. And the important bit there is that the players are all legitimate. Generic competition is not an unfair, illegitimate competitor to original pharma. They work in an ecosystem.
Yes.
And sort of balance out each other.
Yes.
And okay, sometimes one might, you might have Year of the Locust where there's a little too much generic. then sometimes that reverses and you end up spending too much. And is that a problem? Yes. It's a problem for most states in the world that they spend too much on pharmaceuticals. So I think that understanding of the legitimacy of all the players in the ecosystem is important. Mm. And equally to respect the amount of work and the amount of understanding and knowledge that goes into building a modern pharmaceutical product.
Yes.
It's such an amazing ecosystem on that side and these super duper specialized sciences that play together to understand the biology, this complex biology, and figure out that particular antibody is the one we need to to work with. It's impressive. It impresses me each time, and as does the attrition rates, right? That you work on this and you work and you believe and you're excited, and then it turns out to be toxic, or it turns out to not be druggable in one way or the other. Mm-hmm. And then you need to pick yourself up and try something else.
Yeah.
And that's the nature of the originator pharma and biotech beast, that sometimes, even though with the best intention and the best science, it simply doesn't work.
No.
And that's tough as well.
Yeah. Absolutely. And I think that the risk of that increases when you go for these moonshot ideas, right? And we should go for those ideas. I'm not saying that we shouldn't, but as you say, there is also value in incremental improvement. And you look at, I always think of it like, I remember seeing an interview with Jeff Bezos once, and he was talking about the early days of Amazon. And you look at Amazon now and you think like, you couldn't conceive of building a business like that, right? But he tells this story about the early days where he and the engineers used to pack all the boxes and send them out manually and all this kind of stuff. And he said, I had this great idea, and I said to the guy next to me who was packing boxes with me, we should get knee pads. And he turned around to me and said, Jeff, we should get packing tables. And it's like those sorts of little things that's so far away from where they are today, but like it's those little shifts that make the big difference. The Aspen part of your story was really interesting, and I particularly thought it was interesting because you mentioned, it wasn't a true startup. There was a business there, but it was a startup of this entity. However, I think in some ways that makes it more difficult, right? Because in a real startup, you have a bit more time to get to the point where there's, customer pressure, and you kind of work through the problems one at a time rather than having 25 of them just dumped on top of you all at once. Tell me a bit more about that, because that's sort of a blank canvas, but in an existing business and issues from day one. Aspen
works at the time in a way where they buy portfolios of mature products from other companies. And at the time, to establish the Nordic business, Aspen bought a big anesthesia portfolio from AstraZeneca. Mm-hmm. And so these products were coming in. There were other products as well. They were coming in, and this had a Swedish legacy to it, right? And the Swedish hospital pharmacists could call up Astra's headquarters in to the south of Stockholm and sort of say, we need some more of whatever product, and they'd get it like direct. But here they called us and they said, well, hold on a moment, and then I had to find somebody in Dublin who would find somebody in Pretoria in South Africa who would find somebody in AstraZeneca, and then call back in. So that system, that coordination, that level of coordination to make the handover, make it work, get all the orders in the different systems. I mean, it sounds like something where you're sure it works, and we thought it would, but it turned out it didn't. And then you simply start from somewhere and work your way through the questions and the discontent, and when can you deliver and how can you supply, and you sort of build that integration, find the people in the organization that have that information, figure out how to share. And that took us, before we really had it up and running, to an extent where we could predict our supply capabilities and even sort of manage it actively. That took, I think, 1.5 years.
Yes.
So it wasn't 1.5 years of out of stock, but it was the first 3 to 6 months were manic, and it was sort of traveling around, speaking to heads of hospital pharmacies that was sort of saying, well, what are you doing? And can we tender for this product? Do we have supply? Well, I'm not sure, but we can't not do it, because then we have no sales. So in that way, it's a great observation, I think, on your part, that usually you sort of ramp up in a small company, where here it was 0 to 100.
Yeah.
And we hadn't ramped up the organization to sort of meet that requirement.
Yes.
And then, yes, the Nordics are from the outside of the Nordics seen as an entity. But when you're inside, when a person from northern Sweden calls somebody that answers in Danish, it's not easy.
Yeah.
So you need to figure out some language barriers and some other bits and pieces that takes a while to learn as well.
Yeah, that makes sense.
Yeah.
So obviously, the outcome was it didn't quite come together. But what were the most important things you learned from that period, do you think?
Don't panic. And don't panic and approach your customers with sort of a serious, constructive demeanor and response to the extent you can, and state honestly, look, I don't know, I'll do my best to tell me everything you can about your situation. That's what I'll bring back with me.
Yes.
And then, I mean, as silly as it sounds, this assumption that, but they have it covered. Yeah, sure, that's scalable. Whenever you hear like, okay, that's scalable, we can just do what we usually do, that sort of thing. Think twice and ask at least 3 clarifying questions to make absolutely sure what happens if and how about when. To pressure test it, because that's a common denominator that you're never fully ready, and you probably will never be able to be fully ready, but there is lots of preparation you can do, and that is common sense, and it is about having some feedback loops so you catch things early if it goes off track, and you have people that are able to navigate the organization and to make decisions. That's actually the most important thing, to have sort of a hotline. So the mandate is clear and there's somebody that knows the path and they can do something about it. Then you can do a lot of good in that context, I think. So that would be my next Aspen, that would be, I need a hotline to somebody when things go sour. And then we take it from there.
No, that makes sense. You talked as well about how the board seats that you held had to some extent prepared you to take on that CEO role, but it was different. And, I think it sounds like what you did at Aspen also had some elements of it. And but then again, in an organization that existed, what have been the things since you took on that CEO position that, I don't know, that surprised you, or that have been the biggest learning curves, or what have been your observations about stepping into that role particularly?
I think the demand on staying positive and believing in your story, and it's the salesperson story, and I think it's a startup story, that you will get a lot of no's if you even get a response. You'll get some great conversations as well, and you'll meet lots of interesting people. Of course you will, but having the stamina to go through the no's and the non-responses and keep sort of optimizing what you have in the belief that ultimately you will find the lock to which your key fits and you will unlock the potential. I think there's a very big difference in hearing about that and then sort of experiencing it on your own self and body. That's I think the biggest learning.
That makes sense.
In
and when it comes down to your decision, it feels different, doesn't it? And there's less sounding boards that you can call on.
And just individually, if you're a bit of if you have a competitive nature, and you get ready and you gear up, and then but it's not the right time for us. Okay, fine. And when you hear that the first time, then you say, wow, what can I do to get better here? How can I access this? And as long as you do that, you sort of remain competitive with yourself and in the situation. So you have that fuel.
Yeah.
And what you don't want is to run out of fuel. You don't want to run out of belief that this will happen. That's sort of what I mean. So you need to reinvent your message and tweak it and optimize, because in that way you're sort of working with that principle of your key and the lock. So you're looking at different locks, and you have your key there, and you're trying to make it fit. And that just feels very different doing it than hearing about it.
Absolutely.
Yeah.
Yeah.
And of course, then there's loads of elements such as, I wish I'd studied more immunology at some point during my career, because sometimes you sit there and you give a pitch on something that works via the immune system, and the person you're speaking with has a PhD in immunology. So you thought, well, okay, that maybe I'm not able to answer all the questions, but let's figure out what I can, and then we'll work from there.
Yeah, that makes sense. Yeah. Okay. And you've talked a lot about things you've learned and advice and things like that. So it may be something we've already covered, but if we go back to those early days at Leo Pharma and sort of the start of your career, and you bumped into Søren from back then now, is there anything you'd pass on, any kind of piece of advice, wisdom that you think you've picked up that has been particularly impactful?
I would say find people, more senior people that you trust and you can with in confidence, to have that sounding board on career choices. And the more honest they are, the more important they are.
Yes.
There's enough people that will be kind and don't want to disappoint you, so they'll sort of say, well, yeah, go for it. And you should go for it. But having that person that will say, look, it's a nice idea, but spend your time and effort over here, because you'll never get there. Yeah. Can be helpful as well. And I've been super fortunate in that context. I've had an inspirational scientific manager early on, whom I deeply admire because of the way he works scientifically as an individual. And then I've had super ambitious, high-flying executive mentors that sort of did something else for me in that context. And sometimes it's developed into a professional friendship, which is not super simple, because you don't want to overdo the friendship part. Then the professional, you might be sacrificing the professional relationship. Yes. So but if you can make it work, when you can make it work, it's fantastic, because you know each other, you know what it takes and what to expect. And if you can have that honesty in the relationship and saying, that's not good enough, I need you over here, then it can work great. And I've been fortunate enough to have that situation as well. So I would have told young Søren to make sure you find those people that can help you in a mentor way, or maybe get you to your next role, and not be afraid to move around. Yes. Because ultimately that will be, you are building on not only the depth of your knowledge, but breadth as well. And people, you get to know more people in the industry. And I've traveled around and worked in different countries, and that's a sacrifice in terms of the depth of my network in Denmark, where I live. But as a person, I feel super enriched by having met people from other countries. Yeah.
Fantastic. Well, Søren, it has been fascinating talking to you. Thank you so much for sharing your journey. It sounds like a really exciting time at EXOCURE. Of course, there are challenges across the sector at the moment, and we wish you the best of luck in navigating them, because I think you're working on something that could be really impactful. Thank you for taking the time.
Thank you so much, Tom, for having me. Great pleasure.
Thanks for listening. If you enjoyed the episode, please like and subscribe and share it with someone else you think will benefit. And for more podcasts, videos, blogs, and insights, come follow me, Tom Froggatt, on LinkedIn, YouTube, Instagram, Medium, or TikTok. See you next time.